We look at standards for group therapy practice. We oversee the Certified Group Psychotherapist credential. We oversee a training award that's given in group psychotherapy. There is an educational piece too, so educating members about group therapy and providing the educational component for getting the CGP, the Certified Group Psychotherapist credential. Similar to specialties in medicine, group psychotherapy is a specialized form of treatment. So we feel that people need additional training and experience and education in group psychotherapy to be able to lead a group. So we try to promote that generally in the field. I think this trend is fairly new to cut residency programs, to cut group therapy out of graduate training programs. So we are already putting together a plan to go to them and really try to advocate for group psychotherapy. And we feel like advocating for group psychotherapy is advocating for healthcare and for consumers of healthcare. So we feel we're very passionate about that group therapy should be thriving in the environment we're in. As mental health professionals, we're being asked to serve more people in the same amount of time and with the same amount of resources, sometimes with less resources than we have in the past. And group psychotherapy that's where group shines, is being able to maximize a clinician's time, maximize resources, because you can see multiple people at once and you can bring them together and help them to grow together. Group therapy has a lot of added value in different areas. People are doing groups in corporate settings, so they might not call it group therapy, but they're using group therapy principles to teach interpersonal relationships in corporate settings. Obviously, there's the clinical application. Group therapy can enrich individual therapy, so often people can sort of what we call max out in individual therapy, and group therapy can be a nice continuation that becomes more relationship focused, more relational. And I work with kids and adolescents, so I call it learning by doing. So you're in the room with other people and you have therapists, coaches there to help you form and maintain those relationships. The Centers of Excellence program is a really interesting new program that will launch very soon. And it's an organizational level certification that shows that an organization or healthcare facility is committed to upholding the standards of the CGP, upholding the standards of group therapy, viewing group therapy as a specialized form of therapy and not just a service delivery model. So that organization that becomes a center of excellence in group therapy is showing that they're doing the training and they're doing the commitment to integrating group therapy into their overall service delivery. One exciting initiative that the IBCGP is working on is coordinating with international organizations for some possible reciprocity or international credential, and that's an exciting development. It's really exciting to talk with group therapists from all over the world and to increase our level of awareness of what they're doing, vice versa, and to also build on our diversity. So that's one of my goals in my new position, is to increase our diversity so that we are pulling in new theoretical ideas. We're pulling in from different communities, and it's exciting to be involved with AGPA right now because there is so much diversity coming in the door, and it's really nice to see.